Now, if we have integrated Chinese medicine with Western medicine, we might use this kind of program in conjunction with Western therapies.
And how does that work? How do you mix the two of them?
Well, different practitioners have different ways of doing it. I have my own specific way of doing it, which is I stand very strong in the Chinese medicine world, and I really look at the Chinese medicine diagnosis, and according to that, I will make a plan for someone. And then I look at the Western diagnosis, I look at the drugs that a person is on, I look at what their lab tests, I look at all of those things, and then alter the plan accordingly so that there is an integration between the two. One of the things that's nice is also that I feel like we can work together with a physician who's open to Chinese medicine as well. And so we can look at the labs, and we can look at the biopsy, we can look at the ultrasound, as well as feeling your pulse and looking at your tongue and asking you a lot of questions that we do in Chinese medicine, and put together a plan that's based on both of those worlds. And so it's nice if, for example, if somebody's going to go on interferon treatment, the way that we would do it is we would ask the physician, say, hey, look, you're saying this person needs to go on interferon right now, and say, is it an emergency? And most physicians don't think going on interferon is an immediate emergency, that people need to be prepared. And so what we do is we create a plan to prepare somebody to go on interferon treatment. And the way I think about it is that we've got this plan. Person is able to start doing it, and it takes time. It can take 6 months or 8 months or a year to get on the plan. End up on a plan where the only thing that gets added is this interferon injection and ribavirin at the end, or with the new medications. And so there's the biggest, it's basically...
So if I do that, what's it do for me? Does it increase my odds of successful? Does it reduce my... What's it do?
Okay, well, we have a lot of anecdotal evidence. I'm not going to tell you that Chinese medicine is going to cure you of hepatitis C, because it's not. That's not the goal of Chinese medicine. Chinese medicine's goal is quite different. The goal of interferon treatment is to cure somebody of hepatitis C and get rid of the virus. There's no herbal medicines or other medicines that we know of that clear the virus other than interferon combinations. However, having said that, there's a whole lot of things that Chinese medicine can do that Western medicine doesn't do. One of the things that we do in with Chinese herbs and with acupuncture is we help the liver to function better. And so if the liver functions better and somebody goes on interferon, it means that the interferon can work better. And it means that we would have people who would have more possibility of being able to clear the virus. And that is the basic theory that we work on. In fact, Western physicians send people to us before going on interferon in order to prepare people to go on interferon. For example, some people have very low platelets and can't go on interferon, or it's worried that they might have to have a low dose of interferon and ribavirin. And if you start with a low dose, it actually decreases your possibility of clearing the virus. What we want, there's an 80-80-80 rule, where 80% of the time you want to be doing 80% of the drug, at least for the length, 80% of the length of the treatment. And we really support that in using Chinese herbal medicine and acupuncture and nutrition to support that. Now, many people don't need to go on interferon treatment. For example, somebody who has stage 1 disease, has had hepatitis C for 40 years, doesn't have any symptoms. They don't necessarily need to go on interferon treatment to clear the virus, because it's not causing liver disease. They have other things that would kill them first. So when we're working with somebody in that situation, we're just really looking at the Chinese medicine diagnosis. We're looking at how the liver is functioning, just helping somebody to have a better quality of life overall.